There's some excellent guidelines published by the American Heart Association on end of life and palliative care after stroke. Claire Kreutzfeldt and Richard Holloway were amongst the authors, and that's an excellent document that touches on many of the very difficult dilemmas when looking after people with severe stroke. But I think that this is an area where there is very little research. If you do a PubMed search for palliative care after stroke, there are a handful of publications, and this is despite the fact that a third of people will die after acute stroke. So there's a big mismatch between case fatality and the number of publications looking at dying after stroke. So I think we need more work looking at whether we can better refine prognostic scales. And as I've mentioned before, frailty is an important factor that needs to be considered. I think that we need to better understand how to make shared decisions after severe stroke. And we're doing a study at the moment looking at developing a process to help make better shared decisions. And I think that we after we've implemented that in practice, that is a sort of process that needs testing in randomized trials. I think we also need to know a lot more about the dying process, about the symptoms that people experience after severe stroke. And that could be done through observational studies and ethnographic studies. I think we need to understand a lot more about grief after stroke. Our qualitative work has suggested that often in the acute phase of stroke, there is a grief because of loss of the person that previously existed. So loss of speech, loss of ability to move. There's a grieving process there. There's also a phase of anticipatory grief where a family may expect that person to die and start to grieve. But actually then there's the real grief that comes afterwards, that the grief that we typically associate with bereavement. And we don't really understand much about those grieving processes and how we can make the grief more easy to deal with. And certainly some families that I've spoken to have explained how that grief persists for a long, long time afterwards because of the way that the family were treated, perhaps the way the patient was treated. And if things had been done differently earlier on, that grieving process would have been much better. So I think that's a huge gap that needs addressing too.